Hello everyone, welcome to another episode of Plenty with Sulo. Clothing partner G-Flocks, hair and makeup Salon Tobe by Michelle Udugama, venue partner Yasmin Cafe at Masterpiece Showroom Madhiwala Kote. Be tuned to Daily Mirror and Lanka Deepa online. Host venue Yasmin's Cafe at Masterpiece Showroom in Madhiwala Kote. Hi everyone, today our guest. After she completed her secondary education and medical school over a 10-year period in the UK, she returned to Sri Lanka and worked in government, private sector hospitals and NGOs, and finally at the World Health Organization as the focal point for non-communicable diseases. Her 10 years UN career ended suddenly when her sister passed away in 2016 from breast cancer. Her families with over 20 projects and voluntary base of over 5,000 people. Setting up the operationalizing this organization has been one of the most fulfilling achievements in her career as a medical professional for 22 years. The chairperson of Indira Cancer Hospital, am I correct?
Trust, yes.
Indira Cancer Trust, Dr. Lanka Jayasuriya Dissanayake. Hi, Dr. Lanka.
Hi, thank you, Sulo, for that.
I can call you Dr. Lanka,
Of course,
right?
you can just call me Lanka, I think.
No, it's okay. Now, I just did I would say, the definition or the profile you have given officially. But actually, who is Dr. Lanka?
Okay, I think more than myself, I think first of all, I think I'm a daughter, a sister, a wife, and a mother. I think that defines who I am. And I say that because I think I'm more known for whose daughter I am or whose wife I am, which I'm very proud of. I think my father was the former Speaker of Parliament, Mr. Lanka Jayasuriya, and my mother is Dr. Vasantha Jayasuriya. It is their, the way they brought me up that has allowed me to come to where I am today. So the definition begins with them. I also am a sister, and my younger sister Indira, who has played a great role in what I do now. I'm also a wife. Again, my husband is probably more known also because he is now in Dissanayake. He was also a former minister in Parliament. And also I'm a mother to two young daughters of 19 years and 16 years. So that's my personal life. And I think as a woman, and I know, Sulo, you're someone who's a very strong lady who advocates for so many things. But the proudest thing for me at the moment is all those roles that I play as a woman and as a daughter, a wife and a mother. And that has helped me to achieve whatever I have achieved in my career. So I guess Lanka is probably that. And I think you've already read my professional resume
Yes.
of medical school. So that has been something that I have always wanted to do. I think most probably it's my mother's influence, because she's a doctor. My grandfather was also a doctor. So that was something I always wanted to do, but the field I was in was never defined in the early stages. And I think I'm also fortunate to have been able to experience the government sector, the private sector, then also the UN, the NGOs, and to end up where I am today, because that experience in my career has helped me to understand the system, the health system, the patient's need, and that has helped us to kind of mold the organization that I work for now.
So it's a combination, I would say, like this: professional, political, business, right? Then the social service also as a responsibility, right?
Yeah, political, no, I don't
No,
think so.
I'm saying that from the background,
Yes.
father, husband,
Yes.
then the professionally mother,
Yes.
then you, and coming on to, so it's actually, it's a rare, this thing that you come from that background and as you still wanted to do something that is, can make a change, right? So now, as you said, you are the chairperson of the Indira Cancer Trust. What is the story of this trust? Because I know there is a story. You left a promising career and you just came and you want to do something. And we all watched what was on social media, but you know the real story. What's the story about this?
The story as it stands is about my younger sister Indira.
Yeah.
She was a lady who fought, and the spirit of fighting was there in her even from the beginning. Because this is something that we always tell, cancer is not the end of the world. I know you're probably going to ask me that later on as well. And she was a fighter. She was diagnosed with breast cancer in 2008. She had treatment, she had surgery. So one of her breasts were taken out. She had chemotherapy, her hair fell out. Then she worked all that time. She worked from home. She was an investment banker, but she didn't allow the disease to take control of her life. She was very strong. Then she had her first child after she was given the all clear. Okay. And when the first baby was, she was about 4 years when she conceived with the second baby. And that's when she was admitted to hospital about 27 times with pain. Okay. And that's when they did a scan and they found out that her cancer had come back. And unfortunately, the cancer had also spread all over the body. So that was a decisive time for her. The baby was in the early stages of the pregnancy. She was offered chemotherapy. At that time, there was a risk to the baby taking a chemo, and she flatly refused taking it. So she fought. She fought that. She delivered the baby early at 28 weeks. And the baby was very healthy. It was a son. And she actually lived until the baby was 1 year old. She always knew that her time is limited, but she again was someone who valued human relationships above everything. She had a promising career at that time and she used to travel a lot, but when the kids came, her priorities changed. Then cancer came, her priorities changed again. So she valued the time that she had, and she made sure that she spoke with, so the children also understood that their mother had cancer and they may not live. The husband understood. But it was very hard for my parents. I think for a parent to, being a mother of 2 children also, I wouldn't know what to do. And that really was something that my parents found really difficult. So towards the last stage, she passed away on the 2nd of November. End of October, she was suddenly admitted to hospital. And so I flew in from Colombo. And my father was in Geneva on a meeting. And when I went, she was conscious and she was talking to me. I went in the morning. The same day evening, my father flew back. And by the time my father came, she was becoming unconscious. The only word she told me was, she said, a kettle to make a cup of tea for my father. That was the last words that she spoke. And then she was unconscious for 7 days. Now that 7 days, my father was by the bedside. My mother couldn't come, she was not too well. I was there, my children, my husband, we were all there with her. And the treatment that she got, she was not in pain, she was unconscious, but she was not in pain, she was very comfortable. We as a family were looked after. People came and asked us. The doctors came and said, are you okay? Is there anything we can do? You know, your sister is fine, your daughter is fine. The reassurance we got, and palliative care, which is end of life care, is very strong there. So seeing that, holding my sister's hand, my father, he was the one who wanted to do something. I think as a father, what he said was, I don't want anyone else to go through what I did. So what he did was, he said, we should do something after coming back to Sri Lanka. She passed away on the 2nd of November. On the 10th of November, we had the funeral. And on the 27th of November, we set up an organization to kind of start working. So that's the beginning of the journey. And the story, I think, you're also someone who always advocates, life is not perfect. Life is full of up and down, and it's entirely up to you on what you do with that.
That's why I said, be not perfect.
Exactly, yes. You always say that. And life is not, and so many ups and downs. And here also it's a tragedy. Losing a family member is a tragedy, and something that a parent, a sister, anyone finds very, a husband, losing a mother. So those are things which we have converted something positive. So every time a patient walks in through our doors, they see my sister's picture, they have heard of her story, it gives them courage. It's not, you fight, you face it, you come out of it, you may not come out of it, but that's also okay. Learning to accept things in life is, I think, a great thing which all of us should learn. So, and also we should not let something unwarranted happen to us before we realize the value of life, time, family, loved ones, because those are all precious things which not even, money can't buy any of those things, but these are freely available to us. But sometimes we take things for granted. But her story made us realize a lot of things.
Yeah, so it's a saddest thing that losing a daughter, losing a sister, losing a wife and a mother. But then again, you all gave a hope by opening up something like this. What you all saw there, you all try to bring that to Sri Lanka, which was, I think, it's a blessing. Maybe that's how things happens. Sometimes she was the reason for many to get that light in. I think that's what happened. So because I went through that story and I read it, but I really wanted to ask, because what we see on social media is not sometimes the truth, but what happened and all that. So I'll just come to that, because something that very related and something our society should be knowing. People lose hope when they lose loved one, as you said, your parents, right? They lose hope when you lose someone. And we do not have a system to overcome, let go of, because I have seen cancer patients die in my family, and the moment you were told that you were having a cancer, they give up, right? But rather than giving up, living that limited life, also you can live your life because I heard that your mind can actually help you. So you have started this in Sri Lanka. You actually, it's more than just giving medicine. You all give the medicine to the soul and also to the relation. If you can explain it to us how it works.
I think you're absolutely right. It's called the C word, or Pilikawa.
Okay.
Pilikawa kiyapu gaman, what happens is it ends, the whole thing, the story ends there. So cancer means a death sentence. It's not like that. But the unfortunate thing, I would say, you're told, okay, you have diabetes, you've had a heart attack, you have some other skin problem. That doesn't affect you the way cancer does. So why should it be any different? It's just another disease. But unfortunately with cancer, the reality is, first is, it's seen as something is a death sentence and you're definitely going to die. So that's the first myth we have to break. And the fact that you have cancer, then you see an image of a bald person. That happens, but there are also so many things which you can do to lead a normal life. And also now, unlike earlier, once you detect, now we keep on harping about breast cancer, right? So breast cancer is something, because that's the highest cancer in Sri Lanka. We get 12 women being diagnosed every day. We have 3 women dying of it. Now this is not a disease that a person should die from, because if you detect it early, you get a complete cure. So, but the unfortunate thing is we don't seem to catch it early due to various reasons.
Unaware also it's there, right?
Yes, exactly. I mean, for breast cancer, the best thing you can do as a woman is to examine yourself every month. It doesn't cost anything, it doesn't cost any money, just 5 minutes of your time, 7 days after the start of the period. So that's just a habit that which you have to inculcate. So doing such simple things would allow you to detect a cancer early, and it gives you complete cure. So that's the first thing. It's not a death sentence. The second thing is the treatment now is so much better than what was there many years ago. And we have some excellent doctors in Sri Lanka. We have, technical. There's a Sri Lanka College of Oncologists, where all the oncologists are there. We have the Sri Lanka College of Surgeons. We have the College of GPs. So many professionals are there to manage this. So what we have to think about is that, just because you have cancer, it's not a death sentence. And the fact to keep your mind strong. And again, it's very unfortunate because when you look at, especially why I'm talking about breast cancer, because that's the highest cancer. These cancer affects people in their prime, women in their prime who have young children.
Yes.
So that's the time where they have so many responsibilities. So you can imagine, normally in a family, I don't know, Sri Lanka or anywhere else, the woman plays such a big role in keeping everything together. So when that person gets diagnosed with a cancer, you see the family fall down. But that's where, if children are older, you have to step up. Family is there to support you. Husband is there. But unfortunately here we also see now, we talk of hair, we talk of outer beauty and all that. I mean, how much we talk about it, if you see someone with no hair, you always look twice. You always think it's cancer. You look at them in a different way. You feel sorry for them, right? Sometimes we get children who get scared of the parents, who don't go near the mother. Sometimes husbands leave the wife. So those do matter, but there are things we can do about it. So it's not the end of the world, and it's definitely, and we are always there. And we always keep saying, never underestimate the power of a healing touch. The
yes.
statement,
They say, but mostly, now I know that your parents live in Sri Lanka and all these. So most of the parents, and especially the spouses, give up on their wives, right?
Yes.
And I have seen it, I have witnessed it, because some women come to me and say that because I was diagnosed, my husband left me, right? So do you all have a system of telling, helping these women and the families to give awareness about it?
Yes, we do. So we run a helpline.
Okay.
Right? So that's Sri Lanka's first helpline for cancer. So that we operate every day from 7 to 7. And anyone can call us. So we do get many calls. I mean, we get very similar stories to what you're saying, husbands leave. And also, especially if you have young children, when the child is diagnosed with cancer, we have had so many instances where the father has left the family.
Yeah.
So that's also a sign of, they can't bear up with the whole situation. But I'm not saying that's the thing to do, but, there is no coping mechanism. So we do have a helpline. We also have volunteer counselors. We also do counseling on the phone, but not only counseling. The words are very important, but we must also do something. Now, we have different programs. For example, if a parent is diagnosed with cancer, we have a system to support their children through education. But it's a small amount monthly, but it's more than that. We tag them to a family. So they have a family looking after another family. And amazing, the people who have, so we have 278 children at the moment. They are all children of cancer patients, and we still have donors who are waiting to get a child. So there's a lot of response. So what we do is we get the sponsor to talk to the child, they send 1,000 rupees a month through us, but it's a lot more. They give so many other assistance outside of our organization, but it's another, it's a listening ear, it's someone to talk to. They give a phone call every month. And so we have
so they know that someone is there.
Exactly. I think it's not money all the time that you need. It's just to show that someone cares. I mean, we have a program where we take a gift to a child with cancer on their birthday at the hospital. Now, when we go, the parents say, "Ane mataka tibuna neda, mage putage upandine mataka tibuna ne, ane bohom istuti, ane kika denne podi tagga." So, you know.
So it's a thought that matters, that they are also important,
Yeah.
right?
And it's not sympathy. Please don't feel sorry for
Yeah,
patients.
that is the thing. Now my next question is about that, because there's a lot of society stigma. Because these things I have heard, they say when someone get it cancer, they said it's a karma, your past sin is being paid, and something to do with your own fault or your parents, right? And then that sinful this thing comes to the patient, and then automatically she's thinking that she's paying for the karma or the sins of her or him. So actually, is it, since you are a professional doctor and also you are with cancer, I'm asking you very straightforwardly, this is sickness, right? Why now the Sri Lanka stigma is this is to do with your birth, with the karma or the sin. This has nothing to do with like something like that, right? So how to help this kind of myths going away from our society?
I think that's basically absolute education and awareness, because you are 100% correct. And also when you look at, I mean, that's the cause of cancer, then when you go for treatment also, you don't go for the traditional.
I asked it because one of my relations got it.
Yeah.
She never went to treatment, she died at home. And the whole family thought that it's a sin. So I have witnessed it, that's why I thought I'll ask you if you can explain.
Because it happens. So what we do is, when you have to explain, I mean, when you look at cancer, there are things that you can change, there are things that you cannot change, things that will promote cancer. So things you cannot change is, as you grow older, you're more prone to cancer, right? If you're a female and if you have, you know, if there's a family history of, say, breast cancer, you could have the gene, so you're more prone to it. If you've not had any children, if you know, that also puts you at a higher risk. If you've been on the hormone on the contraceptive pills, so those are things which you know, sometimes we do that, you know, that may increase the chance. But 80% of the cancers are mostly because of 4 different factors. I mean, one is the diet. One is the physical inactivity. You know, the recommendation is 30 minutes every day of physical activity, and tobacco and alcohol. So, you know, 80% of the cancers these are called modifiable risk factors. Those are lifestyle things. You can easily change your diet. You can easily do some. I mean, it's not going to the gym, it's sweeping the house, it can be sweeping the garden. It can be, if you're going in a bus, you get off one stop earlier, walking the rest of the way. So, you know, things like that, so that you tend to look after yourself. And also, especially women, I mean, we talk of this TLC, you know, touch, look, check, which is a conversion of tender loving care. And women tend to look after everyone else apart themselves.
I always tell that in an aeroplane you give the safety. The first says, before you attend to your child, attend to yourself. I always put it that to women. I think that you are in an aeroplane, for you to save your child, first look after you.
You must, because as soon as, if you're not there to, you know, you have to look after yourself first, and then you're there to look after the others as well. So the myths definitely has to be counteracted by education. And it's nothing to do with karma, it's nothing to do with rebirth, or, you know, it's just our cultural things that have been inculcated in that. And also, if there is a cancer diagnosed, it's really, you should never go to traditional things. There's always a medical setup here. I mean, that can be, if, you know, first thing is you go to a doctor and there are recommended treatments, go through that. I mean, if they have side effects and things, now there's medicine. If there is hair loss, I mean, we are doing the wig donation program. So you can, I mean, same way you had the hair, you can get a hair. So now,
is it a myth they have colored it, they cannot donate hair, or can people who has colored hair can donate?
Can. Now what happened was, we started the hair donation in July 2017 with Ramani Fernandez salons. And we at the moment have stopped taking hair because we have enough hair.
Oh, okay.
We have, but we will now. We launched a program, a national program with HEMAS, with the Lions Club, and supported by the Ministry of Health and the College of Oncologists. We are going out to hospitals and distributing. We are setting up a system so that patients who, when they start chemotherapy, they don't need to come to us. They would go to the chemotherapy unit, and as soon as they start, what happens with chemo is you start the treatment, then you go home. So it's normally majority around every 3 weeks. And about the second week or so, you go to the shower, you have a bath,
then
and then suddenly the hair comes. That's a very traumatic experience. I mean, so many, it's something that I think you have to experience that to feel it. And if you're strong enough, you're very detached and you say, no, it's okay, it will grow back. But the reality is it's very hard.
I saw a lot of, and India was promoting it, the mother actually shaving her head, and when the woman comes back to work and everyone look at it. So I think it's a cultural change, an attitude change happens to accept them, and it's just a sickness, not that they were being sinful. That is something we should be taking out as a awareness for our society. Cancer has nothing to do with our sins or karma. It's a lifestyle. It's one of the sicknesses, right? So thank you for saying that.
Diabetes, if you happen, you don't talk of karma and all that, or pressure or something, So same way, cancer is just one of the 4 major diseases that kills 75% of the population. So that's called a non-communicable disease. But we see cancer in a different light, unfortunately. So that's something.
Because we are not ready to, and also when we get it, we mentally go die before we physically allow. So when you die mentally, you don't let the physical to fight for the disease.
And I think in your question also earlier, you were saying, how your mental spirit. I mean, that's not something that we just take out of the noun. World Health Organization has recommended now what you call relaxation therapy. So that has a positive benefit, music therapy, art therapy, yoga, meditation. Those are all things which actually support someone who's going through treatment and also, through the disease cancer. So keeping your mind healthy is extremely important. And whatever your religion, you tend to, the religious observances in the country like ours, and keeping your mind healthy will definitely give you the strength to fight whatever is there physically. And we see difference. We see how a patient who's positive, who has the will to fight. I mean, my sister is a classic example. You fight until the end. I mean, then you may not win all the battles.
But her story will be remembered by her husband and the child one day, because my mother didn't give up on us.
No, exactly.
So that's a positive. If you love your loved one, fight for it.
Fight for it, yes. Not give up.
Yes. So the new project, Suvarana, if you can, because that's something I actually read it. And I follow on every step of that. If you can explain a bit about that.
I think we are so proud to be able to set up Sri Lanka's first pediatric palliative care center. Now that's Suvarana. Pediatric palliative care. Now palliative care is a new field, but palliative care means end of life care. And also a lot more. So you give support to the children and their families. So if you look at the numbers, we get about 750 children being diagnosed with cancer every year in Sri Lanka. And the most of the childhood cancer are treated at Apeksha Hospital, Maharagama. They have a very good team of consultants who are specially trained. And most of the children, so if a child gets cancer, it's mostly treated at Maharagama. And when these children come, they get treated. There may be situations where majority of the cancers are cured, childhood cancer, but there are cases. That's a very good case. And but majority although there is a proportion where the child can't make it. So what we have found is sometimes children are from all over Sri Lanka. So in a hospital setup, you can't give what is called palliative care. Palliative care doesn't start at the end of life, but it starts from the diagnosis of your child having cancer. So it has a huge range of services which we aim to provide. So it's a 32-bedded institution, first of its kind in Sri Lanka, and countries are encouraged to have that. So that's why I said we are very proud to be able to do it, and we are just a few doors down Maharagama Apeksha Hospital. And everything is free of charge. You get a room, a family room. Meals are provided free of charge. Then the families can come and stay. If the child is dying or anything, we have room where other family members can also come. So it's basically for a child to spend their last few days, could be months even, at a place surrounded by family, surrounded by a lot of...
so you're all giving that strength of support.
Exactly.
And not only to the child, but to the family also.
Family and extended family
extended family also.
When, if the time is near. These are initiatives, and we are We are the St. Jude's Research Hospital in USA, which is the WHO Collaborating Center for Pediatric Cancers. So they are supporting us technically, and also we get a lot of support from the College of Oncologists and the consultants at the Apeksha Hospital, Maharagama. But once it's set up, I think it will be a good addition and a good strength for Sri Lanka to promote the pediatric palliative care system, and they are doing a lot of work. Dr. Tushari Hapwarachi is leading this field. She's a specialized trainer in pediatric palliative care. So, they are trying to set up a system so that pediatric palliative care will be available in a country like ours. So it's a great achievement.
It's a great achievement.
And we hope to, so it's 32 rooms. We have 3 different floors. So we have a scheme for sponsoring a room where you can actually sponsor a room, you can dedicate. We get a lot of dedicated room, you know, they want to dedicate it to a person who had died in their name. So out of the 32 rooms, we have actually about 10 we have sponsored so far. And we also have the 3 floors, plus we have a relaxation rooftop as well.
Because that's something I think, I remember once one of the doctor specialists came on TV and said, when a child died, the mother didn't have the money to take the body to that village. She dressed her as the child was sleeping and put her on this thing and went on the bus for 9 hours. So I think that kind of a thing, in bringing this, will be a big difference. I think that's something Sri Lanka wants. Yes, we have issues, our own issues, but rather than speaking about issues, why not speaking the positive side which we are bringing? As you said, Indira may have caused pain for you all with the death, but she is giving hope for many others. So that's something I look at it as it. So my final question to you, what is your final message to families with cancer patients? Because more than the patient, it's the family has to be strengthened in Sri Lanka, because we are too attached to each other, right? And we believe, because in other countries, when someone been diagnosed, they won't give you advice, only the doctor. In Sri Lanka, it's the family who give you advice. I have seen someone died yesterday like that. Those are the negative advice. So what is your advice to the families?
I think the first thing is the family member should encourage whoever is diagnosed to fight the disease. Because I think you're absolutely right. Families, we all cling as one, which is a very, you know, it's a very Asian trait to have.
Yeah.
Also, and in countries like ours, we believe in extended family. So you give strength, you know, and the need, you should not allow anyone to fall mentally and give up. So that strength must come from the family towards the patient. The second is, it's not a death sentence, right? There are enough things to do. If there are side effects, there's enough things to do. So please treat it not like a special disease, but just like another disease. So, you know, and then take them through that journey. And don't, I think stigma is still there in society. Unfortunately, it will take, we are trying. We are trying to get rid of it. It will take some time. It's not an overnight journey. So at that point, I think cancer will become another disease, but it will take some time. So how you address the societal expectations, how you address the stigma and all, you must, as family member, give strength to the person, your loved one, to face all that. And don't let a disease stop your life. You know, that's the other thing. If you're working, you know, you go through this, there are precautions which you can do, but I mean, you can easily lead a fairly normal life.
With cancer or without cancer, you will die.
Yeah, exactly.
Right? So just because you get a cancer, don't get ready for the death, but fight for it.
Yes, and there's nothing, it's not a death sentence. And it doesn't mean just because you have cancer, you have to stop your work, you can't go out, you know, it doesn't work, it's not like that. I mean, people in the West also, and in here, you know, you have cancer, sometimes you drive your own vehicle, you go in, you have your chemotherapy, and you might, you know, drive back even. So, you know, it's a very normal thing, and it's a process. It's a process that will take about 6 months to 1 year. So that time, as a family member, you must support and be together. And I think address sometimes what we see also is that when you have cancer, when you're going through that, you may see differences in the personality of your loved one. So be tolerant of that.
And also when someone died, don't call and ask, how did she die? Because I remember one of the patients' spouse has said, it's easy for me to let go of her. But the most difficult thing is to answer the questions which are asking from people, how she died and why it happened and all that. So I think we also has to be very sensitive, as you said, empathy needed more than sympathy.
Yeah, definitely
people are good in giving sympathy, but they forget to empathize with the people who are living.
And I think I always, because we at Indira Cancer Trust, we are a team, right? And each of us there have made it our personal journey. I mean, if you look at we are one of the youngest organizations in existence, just 5 years. But our team, so we have a trust board, we have our patron, my father is a patron, the trust board, and we have a staff member, 3 staff members, and we have volunteer coordinators, and we have the volunteers. And each of us have our story. I mean, I'm sitting here today saying a story, but if you go to the trust, each of them have their own story, and we have made it our personal journey to support. So we are here, and anything is also possible, because I know when we started this journey 5 years ago, we never thought that we would be where we are today. And we are doing that because of the team effort, and we don't expect anything at all in return. But all of us, due to the experiences we have had, we gain a lot of happiness in what we do. We get a lot of mental satisfaction. And as Buddhists, a lot of people come and, they invoke blessings on my sister also. So those are, that gives us peace of mind. And that's actually, for us, even my parents, it's, I think it's kind of, it's a way of converting one's tragedy into something positive. And like what you said, using that opportunity to help many more who can. So that in itself is something to be, I think, happy about. But we are always here. So I would, just call us, connect with us. And whatever, the organization was set up so that anyone with cancer, and we have looked at all the different needs of cancer patients. So physical, emotional, financial, anything, we are there to help. So you're not alone. So that is probably the message.
Something, the message you can. Yeah. So as she said, you're not alone, and it's not the death sentence, and there is a hope. Fight for your life. And today we had the discussion with the chairperson of Indira Cancer Trust, Dr. Lanka Jayasuriya Dissanayake. Thank you so much for accepting our invitation. Thank you everyone. This is Plenty with Sulo.